Hi, my name is Melissa Brown. This is Chris Parkinson, my patient for the physical exam. Before I get started, do I have your consent to film this for my class?
Yes.
Great. I'm just going to start by washing my hands. While I do this, the first thing I'm looking at is just your overall skin tone. I'm just making sure that it's pink and even. There's no signs of any cyanosis, which would be bluing, or jaundice, which would be yellow. Everything looks good. It's nice pink, even. I'm going to start by looking at your scalp, so if you'll face your head forward for me. I'm just looking, I'm making sure that the hair is evenly distributed. I'm also making sure that there's no major deformities. I'm going to start to palpate your scalp. I want you to tell me if there's any tenderness with this. I'm just making sure that there's no lesions or masses or lumps. Okay, that all seems good. I'll have you look back up at me. The next thing I'm going to have you do is I'm going to have you wiggle your forehead for me. Great. I'm going to put some resistance here. I'd like you to try to close your eyes against it. Great. Can you puff out your cheeks? Clench your teeth. Great. I'm going to palpate. I'm just palpating up here. These are your temporal arteries. I'm also going to put my fingers here on the T and J. And I'd like you to open and close your jaw for me. Can you move it side to side? Good. I'm going to have you clench your teeth again. And I'm going to try to pull down on your chin. Don't let me. Very good. Now I'm going to palpate your sinuses. Tell me if there's any pain with this. Good. So the next thing we're going to do is we're going to focus on your eyes. Usually we have a chart on the wall. It's called Snellen chart. There's several letters on there. And you would stand 20 feet away, and you would read the lowest line you could, and that would tell us how accurate your eyes are. But since we don't have that, we're going to move on to the next part of the exam. What I'm going to have you do is I'm going to test your peripheral vision. I'm going to come close to you here, and I'm going to bring my hands in, and I want you to tell me when you see them. Looking straight at me.
Okay. Okay. Okay.
Great. I'm going to grab my pen light, and we're going to test your ocular movements. Keeping your head straight, I want you to follow this with just your eyes. Follow it as it goes close to your nose. Very good. The next part's going to involve light. I want you to look straight at me while I check your pupils. Just checking to make sure that they are round and reactive to light and equal on both sides, which they are. The next thing I'm going to do is I'm going to test your light reflex. I just want you to continue looking straight at me while I shine this in your eyes. Very good. We're going to move on to your ears next. The first thing I'm going to do is inspect your ears. I'm just making sure that they're symmetrical, they're in the correct position, they're well proportioned. That all looks good. I'm going to do some palpation. I'm going to just tug on the auricle up here. Is there any tenderness with this? Nope. And I'm also going to push in on the targus here. Just let me know if there's any tenderness there. Nope. Alright. We're going to do one test for your ears, which is the whisper test. So I'm going to have you close one side, and I'm going to whisper a word and a number on the other. You tell me what I say. So close whichever side you want to start with.
Banana 24.
Okay. Can you close the other side?
Apple 18.
Great. So we're going to move on to your nose next. For the nose, I'm just going to look and inspect it first, making sure it's symmetrical, that there's no bumps, and it looks like it's been broken. I'm only going to do one test for your nose, which is we're going to test the patency. I'm going to have you close one side, breathe in and out, and then do the same thing with the other. Okay. Perfect. So we're going to move down to your mouth next. I'm going to take my pen light here, and I'm going to have you just open your mouth up for me. And I'm just looking inside, I'm looking at the buccal mucosa, I'm just looking at your teeth, your gums, making sure there's no lesions or anything like that. The next thing I'm going to have you do is open your mouth and say ah for me. Great, so the soft palate, uvula, open up, great midline. The last thing I'm going to have you do is just stick your tongue out straight for me. I'm just making sure there's no tremors, no malodor, everything seems good. All set. So the last thing we would do is a gag reflex, where I would take a tongue depressor and test your gag reflex, but we won't do that today. We're going to move down to your neck next. So what I'm going to do is first inspect. I make sure that it's symmetrical, there doesn't look like there's any deformities, and then I'm going to start palpating. So I'm going to start by palpating your lymph nodes. I want you to tell me if you have any tenderness in any of the areas I touch. Great. The next place I'm going to palpate is your carotid arteries. I'm going to do this one at a time. Good. You can lift your head up just a little bit and look at me. I'm going to test to make sure that your trachea is midline. So now what we're going to do is we're going to test your range of motion of your neck and the strength. I'm going to ask you to tilt your head forward, tilt your head backwards, tilt your ears to each side. Now can you turn your neck to each side? The next thing we're going to do is we're going to do that with some resistance. So I want you to try to push against my hand, backwards, side, side. And I'm going to have you do a shoulder shrug while I try to resist you. Great. So the next thing we're going to do is we're going to move down the body, and we're going to move to your chest in your thyroid gland. So I'm going to have you turn your body this way for me. Excellent. So the first test we're going to do is for your thyroid. I'm going to place my hands here, and I'd like you to swallow for me. Great, and one more swallow. Excellent. So what I'm going to do now is I'm going to be looking at the back of your chest. Usually you have your shirt off, and I'd inspect your chest to make sure that it's symmetrical. I'd also make sure that your shoulders were symmetrical and that the muscle tone was good. So instead, we're going to move on to palpation of the back. And I'm going to just palpate down the sides. I want you to tell me if there's any tenderness with any of this. And then I'm going to palpate your spinal processes. Again, tell me if there's any tenderness with any of it. So the next thing I'm going to do is I want to make sure that your breathing is making your chest symmetrical. So I'm going to have you sit forward a little bit for me. Great. And I just want you to take a nice deep breath in and out. Good. And I'm just going to wrap back here, and I'm going to have you do that again. Excellent. The next thing I'm going to do is just be checking for any CVA tenderness. So what I'm going to do is just palpate here, and you're going to tell me if there's any pain. Great. So we're going to move on to auscultating. I'm going to place my stethoscope on your back, and I want you to just take deep breaths in and out every time I place it. actually going to have you turn back this way for me, and we will examine the front of your chest. Okay, so again, I'm looking at the front of your chest and making sure that everything is symmetrical and everything looks in proportion. I'm going to move on to doing auscultating of the front. So again, you're going to take nice deep breaths in for me. You're sitting here, we're going to listen for any murmurs. So what I'm going to have you do is just lean slightly forward for me. I'd like you to take a nice deep breath in, exhale, and hold the breath out. Again, can you take a nice deep breath in, exhale, hold the breath out. Great. And I'm just listening in that area with the bell of my stethoscope. So the next thing we're going to do is we're going to move on to your upper extremities. So what I'm going to do is I'm going to ask you to just bring your hands up for me. And I'm going to just start by inspecting your hands and nails. I'm just making sure that the contour is good, they're symmetrical, that there's no lesions. And then I'm going to start with palpating. So I'm going to palpate each joint in your fingers and your wrist. You tell me if there's any pain. While I'm here, I'm also going to palpate to check the temperature of your skin and also your skin trigger. So I'm just feeling, making sure that they're both the same temperature and that there's no tenting, which would show any signs of dehydration. Great. You turn your arms this way, and I'm just going to feel for some pulses. So just checking your radial pulse, your brachial pulse on each side. I'm also going to check these lymph nodes that are in this area, the epitracheal area. Great. So now we're going to test some range of motion and strength of your upper body. We're going to start with your shoulders and work our way down. So what I would like you to do is I'd like you to put your arms out to your sides. Now put your arms down. Now can you put them forward? And can you hyperextend them back? Great. Then what I'm going to have you do is I'm going to have you bring your arms up like this. And make your arms nice and straight right here. Alrighty. And I want you to turn one arm in with your arm here nice and straight. So you're going to turn in and then away from your body. Great. Can you do that with the other side? In, away from the body. Awesome. The next thing we're going to do is we're going to move down to your wrists and fingers. So I have you take your hands like this, down with the hands, up with your hands. Take your fingers and go down with just the fingers, up with just the fingers. Okay, can you make a fist? Great, can you spread your fingers? Can you touch your pinkies to your thumbs? Can you take your hands like this and turn them in and out? Great. So then the next thing we're going to do is we're going to test the strength of your body. And we're going to do a little bit more range of motion with your arms here. So what I'm going to have you do is I'm going to have you do extension and flexion of your arms. So bring your arms like this. And can you bring them up just, and then all the way down. Great. And then can you do pronation and supination, which is going like this. Turning them side to side. Great. Now we're going to test your flexion and extension against resistance. So I'm going to have you bring your arms up like this for me. I want you to push against my hands. Great. Can you pull against my hands? Great. We're going to do the same thing with your wrists. So turn your hands this way. I want you to push up against my hand. Can you push down against my hand? Good. Push up against my hand. Push down against my hand. Good. And also, while we're down here, I'm going to just take a look at your fingers and check your capillary refill. So I'm just going to push down on your nails. Good. That's less than 3 seconds. Okay. Okay, so for the next part of the exam, I'm going to have you lie down. So if you proceed over to the exam table over here, just lie down flat for me. I'm actually going to have you lie down all the way flat. Great, just like that. So what I'm going to do is I'm going to look for your jugular pulse, and I'm going to have you turn your head to one side, and I'm just looking to see if I can visually see the jugular pulsation, which I can right here. So I'm going to have you turn your head again to the other side, and I'm just doing the same thing. Great. So the next part of the exam, I'm going to focus on your heart, and I'm going to have you just put your arms down to your sides for me. Usually we would inspect if you had your shirt off, and I'd be looking for any kind of pulsations or thrills that were visible in the heart area. But instead we're going to move on to the next part, which is palpation. And I'm going to just palpate a few areas of the heart. I'm just feeling for any kind of thrill. So the next thing we're going to do is I'm going to auscultate. I'm going to first listen with the diaphragm of my stethoscope and then the bell of my stethoscope. Again. So this first spot I'm listening to up here is your aortic valve, and then your pulmonic valve. This is called Herb's Point. Your tricuspid valve, and your mitral valve. Great. I'm also going to take a listen to your apical pulse. I'm just going to use my watch here so I can listen for 15 seconds. So what I'm going to have you do is I'm going to have you lean towards your left side a little bit. Yep. And I'm just going to take the bell of my stethoscope and I'm just going to listen down here at the apex. Very good. So you can lie flat again. For the next part of the exam, I'm going to just look at your abdomen and your hips. So if you'll just move your arms for me. So usually we would inspect your abdomen, and I would just be looking for symmetry and contour and no masses. With the abdomen, the assessment is different. I'm actually going to start with auscultating, and I'm going to start in your right lower quadrant. The next thing I'm going to do is I'm going to percuss. So I'm just going to tap a little bit, and just a few seconds. Okay, and the last part I'm going to do is I'm going to just do some light palpation. Let me know if there's any pain with any of this. Great. We're going to move down to your hips. I'm going to have you do some range of motion with your hips. So the first thing I'm going to have you do is I'm going to have you move this leg away from your body. And now towards your body. Same thing with the opposite leg. And towards your body. And can you lift each leg up one at a time, straight? Great. Other leg. Great. I'm going to have you bend this knee up for me. And I'm going to have you bend it like this. And I want you to turn this part of your leg forward like that. And then turn it towards me. Great. Same thing with the other side. Nice and straight. Turn it in. Turn it away. Great. You want to test your muscle strength. So what I'm going to do is I'm going to put resistance. I want you to lift your leg up. Good. Other side. Good. I'm going to have you try to move your leg away. Good. Other side. Excellent. Now we're going to move to your lower extremities. For the lower extremities, I'm looking at the bottom of your legs. I'm just making sure the hair is evenly distributed. They both look symmetrical. That all looks great. Do you mind if I take your socks off? Great. So again, I'm going to inspect your legs down here. I'm inspecting the toes, making sure that all the nails are even. I'm going to test your capillary refill down here. Good. Good. I'm going to palpate for some pulses. Can you turn your legs outward a little bit? Good. So I'm just going to test your popliteal pulses here. Excellent. Tibial. And then down here. Alrighty. I'm also going to test the temperature of your skin. Just make sure it's even. And I'm also going to look for any edema. Great. The next thing we're going to do is we're going to do some range of motion and strength of your ankles. Can you bring your feet towards you, away from you, in, and outward? Great. Can you curl your toes for me? Can you straighten your toes out? Good. I'm going to have you spread your toes. And I'm going to just look and make sure there's no lesions in here. Okay, I'm going to test the strength, and I want you to push against my feet, hands. Okay, now pull against them. Great. The last thing we're going to do is I'm going to have you run your heel down each shin. So take this heel and run it down this shin for me. Great, and can you do it with the other side? Excellent, and then I'm going to just check the Babinski reflex up the bottom of your foot. Sorry if that tickles. Alrighty, so if you don't mind, I'm going to have you sit up for me and come sit here. Okay, so we have two final things left. The first thing I'm going to do is I'm going to check your strength of your knees. So you can sit all the way back in the chair. And what I want you to do is I want you to push with your leg against my hand. Okay, can you pull in? Good, same thing here. Great, same thing here. All right, I'm going to have you let your legs dangle. So try to sit back as far as you can. I'm just going to check your reflexes. Great. Great. I'm going to have you close your eyes for me, and I'm going to touch places on several places, and you tell me where I'm touching. So go ahead, close your eyes.
My cheek, my arm, my hand, my leg, my foot.
Okay, keep your eyes closed. I'm going to place an item in your hand. I want you to tell me what that item is.
A pen,
Right here.
a paper clip,
Great. Keep your eyes closed. I'm going to take one hand. I'm going to move your finger up and down. Tell me which direction it's going.
Up and down and up.
Great. Open your eyes for me. The last thing I'm going to have you do is called a rapid arm movement. I want you to take your arms and just flip them back and forth several times quickly. Great. So the last part of this exam is going to involve you with gross motor. So I'm going to have you stand up for me. You can stand as close to the exam table as you can. And I'm just going to have you walk across the room. Great. Can you turn around? Can you take a few steps on your toes? And stop. A few steps on your heels. Great. And you can turn around again. This next test is called the Romberg's test. It's where you close your eyes and just stand still for me for 20 seconds. I'm going to stand here in case you get any swaying. So go ahead and close your eyes. Great, you can open your eyes for me. The last thing we're going to do is what's called a shallow knee bend. So I want you to stand on one leg and then just shallowly bend with the other side. Okay, other leg. Great. Just to end the exam, I'd just like to say thank you for participating.